Today, banks are expected to be open and secure. That's why IBM has designed the first financial services-ready public cloud that gives you the best of both worlds. So banking can be easier for banks. Visit ibm.com/financial cloud to learn more. IBM, let's put smart to work.
Right now it's 8:39 at 55 KRCD Talk Station. Hope you're having a happy Monday in spite of the realities going on in the world. There's always a reason to put a smile on your face. And there's always a great opportunity to get information, and I am blessed to have to be able to welcome Dr. Arthur Pancioli. He is a doctor with UC Health. He's the chairman of the Department of Emergency Medicine at University of Cincinnati College of Medicine, where he heads more than 60 emergency medical faculty members. That's just a brief slice of his unbelievable CV. Doctor, I want to welcome you to the program, Dr. Pancioli.
Brian, thank you for having me.
Real pleasure, my friend. Let us start with, there's a lot of misinformation floating around on the Internet. You know, I read one time, Abraham Lincoln said, if you read it on the Internet, it must be true. There's a lot of misinformation going on out there. Drinking bleach will not cure coronavirus and might kill you. That's one. Let's start with who we can trust. Now, obviously, we trust the doctors at UC Health. But when we're looking for solid sources of information, what is the most reliable place for our listeners to turn, Dr. Pancioli?
Sure. It's pretty straightforward. If you want local information and Ohio information, the Ohio Department of Health has a website, and it's quite good. It has the most updated data on it. I've looked at it this morning. The CDC, the Center for Disease Control and Prevention for the United States, has very clear, very thorough, and quite accurate data. And those are the first two places I would go to.
Fantastic. I certainly appreciate that. Now, how are things at University of Cincinnati and the various hospitals? We keep hearing about trying to, flatten this curve so our hospital systems aren't overwhelmed. And the statistics that are floating around right now, part of it is ventilators, respirators. We only have nationally about 100,000 of these, and this obviously being a very significant and severe respiratory problem for some folks. How's UC handling it, and how are we going to deal with a potential influx of more folks with severe respiratory problems?
Sure. And so the first thing I'd like to say is, if you don't want to listen to the politicians, that's fine, but please listen to the physicians in your community. Brian, the way we have to think about this as a population is that there is an enormous amount of water going to come over the levee and flood us, and those are cases, right? And we're not going to be able to diminish the amount of water that's going to come over. It's coming. It's just going to happen. The simple fact is, though, imagine a flood. If all the water comes at once, the destruction will be terrible. If we can diminish the rate that it comes over the levee, if we can slow it down, we can handle the consequences much more effectively and much more efficiently. So if our citizens will please heed the warning, guys, this is real. We need to do all of the things you're hearing about, the social distancing, stay apart, slow down the spread so we don't do what Italy did. On February 20th, Italy had its first intubated case up in the Lombardy region, and within 4 weeks, there were 800 patients on respirators in that same hospital district. So the first thing we need to do is slow it down as a community. Then all of us in healthcare are preparing. We've emptied out all of the elective cases. We have many ICUs ready for when this comes. Will we be overwhelmed? It's distinctly possible. Have we done everything we can so far to open up additional care centers? In our emergency departments, we've opened up multiple large tents out front, which frankly just give us more space, allow us to segregate patients into respiratory illness and non-respiratory illness, because people are still going to fall down and break their ankle, and that's very unfortunate, but I don't want them in the same waiting area or the same treatment area as the person who might have COVID-19.
True.
So at UC, we've literally divided our emergency department physically into two separate care paths in order to try to diminish spread. So we're doing all that we can, but we need all of Cincinnati to do it with us.
Amen to that. Now, what are those folks? I understand that elective surgical procedures have been canceled, and that makes perfect sense because you need those resources free for those that are in critical need. But what about those folks who are, for example, and I have many friends, more every single week it seems, and it's a tragedy, but getting necessary treatments like chemotherapy, are they going to still be able to get their treatments? Are those folks going to be isolated? Because they're certainly at a much higher risk given their immune system being in jeopardy.
Yeah, that's really true. So undeniably, there are things that are still considered medical necessities that are still going on. Lots and lots of things are being done to keep people separated, to try to diminish risk, to try to use protective gear for those who are caring for them, which we change out in between patients to diminish the risk of transmission. Undeniably, coming to an area where care is being provided does elevate risk, but there are disease processes that you just can't put on hold. A lot of things we can put on hold, and I hate to think about the people who have knee pain and need the replacement, and it's terrible to imagine another month or two of waiting, but that's what we have to do. But the necessary stuff we're still doing.
All right, I tell you what, we'll pause right now. Coming up at 8:45, we'll continue with Dr. Pancioli, one of the great physicians at UC Health, on how we can deal with this coronavirus and maybe see if there's any glimmer of hope out there in terms of medicine helping to treat this. Be right back after these brief words. I hope you can stick around. 8:49 right now, 55KRC Talk Station. I want to thank UC Health for what they do day in and day out, helping us achieve the best health we can and dealing with problems like, yes, coronavirus. I have Arthur Pancioli, Dr. Arthur Pancioli. He's the chairman of the Department of Emergency Medicine at UC, talking about the coronavirus, how UC is responding, and the reliable places we can look for information, the Ohio Department of Health, CDC. Let me, before we launch into more questioning, Doctor, on behalf of all of my listeners and everyone here at iHeartMedia, I want to thank you and all the doctors and staff and support staff at UC and all of the hospitals and healthcare providers for doing the work you do. Obviously, you run a higher risk of exposure than anybody, given you're surrounded by sick people. And God bless you for going into work each and every day. I just want to thank you for that, sir.
Well, thank you. And you know what, Brian, we really are all in this together. I mean, I may be at high risk, but what about the person who cleans the room after the patient?
Yes.
What about the nurses, the techs, every single person? And in fact, we're all in this together, right? This whole community, and we need to think of it that way.
Which is exactly why we should heed these, separation orders, the safe distancing, and only going out if absolutely necessary. I get all that. Now, let me ask you briefly, are you having any issues? And we've learned, sadly, we learned late in the day, or woke up to the reality that all of our drugs, and I know that's a little bit of an overstatement, but a lot of our drugs are sourced from China. We don't have any independent manufacturing facilities, or at least an independent place to get the core ingredients that go into these drugs. Are you seeing any slowdown in supply? Are there any shortages you've noticed yet, Dr. Pancioli?
Yeah, there are a few, none that are affecting care at this time, but undeniably a shortage of so many things. When you interrupt the global supply chain, when you have masks that we can't get enough of or testing kits that we can't get enough of, other drugs will follow as well. Right now, we're still providing all the care that is needed, but we will be very careful. And fortunately, with medications, there are often ways we can substitute one for another, but it could become more difficult.
All right, fair enough. And speaking of medications, I've had any number of people not only call today, but I've read the combination of a couple of different drugs, hydroxychloroquine and erythromycin, apparently showing some positive results in reducing the symptoms of this coronavirus. Is that something you're familiar with? Can you comment on that, Dr. Pancioli?
I can. There are a lot of very, very small studies where maybe they tried it in 30, 50, 100 patients, and it looked good. Having done drug science, in my case, doing research for stroke for the past couple of decades, I'm very used to the concept of how do we advance science for medications. And I will tell you, some of these things have some promise. That's very exciting. What is being done is exactly what needs to be done, and that we need to do true comparative studies. They're being done very quickly because there's a lot of patients to do it with. But to just throw a medication in because it might work really lacks some thought, because, you have to realize if a medication has an effect, the medication probably has a side effect.
Yeah.
So it's not automatic that because something offers hope that it offers all positive hope. As scientists, we all know we've been surprised when we were just sure something would work, and it frankly didn't. So between some of the antiviral drugs, remdesivir from Gilead, the hydroxychloroquine that has been mentioned, there are reasons to think mechanistically that they might work, but we really need to do at least some reasonable size tests of comparison of people who got it versus patients who didn't, and to see if it really actually benefits the group of people that are going to get it.
And I think it's important to note this is a new virus. There are other coronaviruses in the world, but this is a new strain, a new version, and so we're learning more about it every single day we study this, right, Doctor?
That's really true.
All right, now and I understand that we've all been told about the symptoms. Maybe early symptoms are sore throat, a cough, may look like the flu. It could very well be the flu. Do you have any recommendations for folks who may be experiencing that? Is it seasonal allergies? Is it coronavirus? What do you recommend my listeners do if that hits them or someone in their family?
Yeah, interestingly, things like the stuffy nose, sore throat really aren't commonly the symptoms. Coronavirus causes a much what we call lower respiratory infection, so it's much more cough and shortness of breath, fevers and aches. So it does have some overlap with the flu for sure. And in fact, we were hoping they wouldn't overlap a ton, but some data out of Stanford now tells us that up to 20% of people who have coronavirus simultaneously have flu virus in their system. So they're very, very similar. But you know what it really comes down to, Brian, is people need to recognize that A, we don't have a medication that makes a difference that we know of right now. B, unless you are severe enough that you need to be admitted to the hospital, we don't have anywhere the testing kits to just test randomly or to test the asymptomatic or the mildly symptomatic. This is why people who, if you think these symptoms that you have are the kind of thing you'd stay home for if you thought it was just the flu, stay home for this too.
Amen.
Because coming to a care center increases everybody's risk. Yours, because you might not even have it and you might get exposed, and the providers and the potentially sicker people around who you may be exposing if you do. If your symptoms are not severe enough that you need to be admitted to the hospital, call your doctor, self-isolate, and stay home.
Sounds like sound advice. Dr. Pancioli, that's what we'd expect from one of the UC Health doctors. And I can't thank you enough again for going to work every day, doing what you're doing. You guys are the true heroes out there during these crazy times, but also throughout the year. God bless you, sir. Stay well, and salute to all of you at UC Health for what you're doing.
Thank you for helping us get this message out there, Brian. We appreciate you.
My pleasure, and you are always welcome on my program, sir. Have a wonderful day, and again, stay well. 8:55 right now.
Shopping for insurance can be time-consuming. That's why when it comes to your auto and home insurance needs, make things simple and trust the experts at Allstate. They help you get the coverage that fits your needs while helping you bundle your auto and home. Bundling saves you money and time, so you can enjoy the things that matter most.
Contact Cincinnati agent Christopher Haney or tap the banner to learn more.
Are you in good hands? Not available in every state. Subject to terms, conditions, and availability. Savings vary. Allstate Fire and Casualty Insurance Company, Allstate Property and Casualty Insurance Company, Allstate Vehicle and Property Insurance Company, and affiliates.